so let's do this again. Here is, well, I'll do it on this heart. It's kind of hard to identify your right and left atria because look at how tiny. Here's the right atrium. Here's the left atrium, this gray part, and then the ventricles, this big thing here. And this, see where the vessels are together? This is your conus arteriosus, and then you have one right truncus arteriosus and a left truncus arteriosus. Okay, so if we look at a truncus, it's going to split into three major directions. You're going to have one more anterior branch that's the carotid trunk, and it separates into the external and internal carotid arteries. You're going to have a middle branch that winds down here into the thoracic cavity, and it meets up with the other systemic arch to form the dorsal aorta here. Okay, so we can see all the arteries really well if we move all of the organs off the back. So you can see it right along the dorsal body wall here. Your frog is this is like a lymph node.
Yeah, I was wondering what that was.
There's a lot of them.
Yeah, there's a lot all over.
I bet, yeah. Be careful, because he probably, or she probably has like flukes and stuff. They'll die really well in formalin, so. Right. Parasites. Yeah. All right. Yeah. It's like everybody's steps away. Here I am, like with my mouth hanging open. Okay. So here, let's look at your left truncus arteriosus. And the left truncus, look, there's one branch anteriorly, a middle branch, and then there's this posterior branch. See that? Okay.
Yeah.
Okay. So this anterior branch, this is called the carotid trunk. Okay. Carotid arch. Did I say carotid trunk or carotid arch? Carotid trunk. All right. Okay. So look, the carotid trunk splits into two vessels. There's this medial one. This is the external carotid artery. And then we know that this one on the lateral end is the internal carotid artery because it has that bulb. Okay. This bulb is called the carotid body, and it contains all these sensory receptors for pressure, oxygen, carbon dioxide, pH, and stuff like that, because the internal carotid artery is going to dive deep and medial and head directly up to the brain. So having these sensory receptors there are going to make sure that the brain is getting all the right oxygen and pressure. Okay, so then this middle, see this middle one here? If we follow it, it turns all the way down around, and then it joins with the systemic arch from the right side. When we peel up the kidneys, we can see it continues as one vessel down the dorsal aorta. Okay? So that's your systemic arch, your left systemic arch. And so finally, so take a look here, this most posterior branch here, it splits one vessel, see it's going toward the skin. So this is the pulmocutaneous arch. This vessel going toward the skin here is a cutaneous artery. And see this one going to the lung? That's the pulmonary artery. Okay, so pulmonary, cutaneous. And one thing I forgot to show you is that when we have our systemic arch right here in the middle, it turns down this way. But if we kind of peel some of this back, we can see there's like a huge branch that's going into the arm, which is over here. It's okay, but it goes off into the arm. You can see here's a big tributary here, and then the part that goes to the arm is cut off because the arm's over here. All right, so this is a subclavian artery. The subclavian comes off the systemic arch. Okay, so I can see there's one on this side. If you just follow it, it goes into the arm. Okay? So it's going to dive deeper here than this cutaneous artery that goes up further. It's more anterior. Okay, so you guys have that. We have our conus arteriosus, our truncus arteriosus, and the truncus arteriosus has a carotid trunk, which splits into an external and internal carotid artery. The internal carotid artery has a carotid body. There's a middle branch, the systemic arch, which continues on down to form the dorsal aorta. It also splits off anteriorly and laterally to form the subclavian artery. And then we have the most posterior branch right here. This is the pulmocutaneous trunk, and it splits off into a cutaneous artery and a pulmonary artery. Good? Mm-hmm. Okay. So now what we're going to do is we're going to peel all the organs off to one side so that we can identify the ventral, or not ventral, the posterior vessels. Okay, so look at, I have everything peeled off and I'm underneath the kidneys. Mm-hmm. Okay, so stomach's up here. I'm going to stretch it out. There's my spleen. Mm-hmm. Okay, so right after the two systemic arches come together to form this dorsal aorta, there's a huge branch off of it. And this is called the celiaco-mesenteric trunk. Right? And the celiaco-mesenteric trunk, look, it has two major divisions. There's one that goes anteriorly. This is the celiac trunk artery. Okay, and look at, I'm going to peel away, what is this, the greater omentum, right? I'm going to peel away the greater omentum here so that I can identify the two main branches of the celiac trunk artery. Okay, it looks like there's three here, but we'll pretend there's two. All right, so there's one here. This is the hepatic artery, gastric artery. Okay, so the celiac trunk artery splits into the hepatic and gastric. Okay, so celiac trunk, or celiaco-mesenteric trunk artery branches into the celiac trunk, which branches into the hepatic and gastric. And then there's a mesenteric branch that goes most posterior. Look, so here's your spleen. See this pink artery here? This is a splenic artery. The mesenteric artery, if we follow it, continues into the jejunal ileum where the mesentery proper is. Okay? So then, if we lift up the kidneys, you can see the dorsal aorta here. I'm going to remove this lymph node. And all of these little arteries that are going up to the kidneys, those are the renal arteries. We're going to scratch this posterior mesenteric artery because I keep breaking it. But what we want to do is look back at this posterior part of the dorsal aorta. Okay, and you can see it splits off into two major branches, one going to each leg. These are your right and left iliac arteries. Okay? All right, so now the veins. You just need to know a few major veins. Okay, so your first vein here is this ventral abdominal vein. And Chloe still has hers intact. So see this ventral abdominal vein? It enters the liver just around the area of the gallbladder. Okay, so this is one way that blood from the posterior gets back to the heart. Okay, so this is the ventral abdominal vein. The next way is I'm going to peel all the organs off to the side, but this time I'm going to look at the tops of the kidneys. So I'm not lifting up the kidneys off the dorsal body wall. I'm just going to look at the kidneys head on. Okay, so here's a kidney, and then here's the other kidney. And you can see this big blue vein in the middle. Mm-hmm. Okay, that's the post cava or posterior vena cava. And if you peel some of this mesentery away, you can see that there are little blue veins coming from the kidneys and into the post cava. These are the renal veins. Okay, so my post cava, if we follow it here, It continues on up into, look at how big it is, into the liver, and then it's going to emerge in the sinus venosus underneath the heart. Okay, so here's the sinus venosus here. All right. So ventral abdominal vein, post cava with the renal veins. And then finally, if we look in the stomach here, we look in our greater omentum, we can pick up this huge tributary vein here. So it's got all these little things coming from the stomach and then going up into the liver, posterior to the gallbladder. This is the hepatic portal vein. Okay, so 3 veins: ventral abdominal, post cava, and hepatic portal. And just remember that the post cava has those renal veins on it. Okay?
Don't even know, like,
No.
if you have, like, do we have to discuss